Welcome to our debut show, Health Talk. I'm epidemiologist Nancy Zecco and also a member of the Board of Health in Webster.
Hi, I'm Kathleen Liberty. I'm the health agent for the town of Webster.
We're going to be bringing to you selected health topics with special guests twice a month. And this month, Gabby, or this week, we're going to be talking about influenza. I don't know about you, but I have so many questions about the flu and getting flu shots.
And Nancy, you're not the only one. During flu season, the Board of Health receives many calls from the public with concerns.
Guess what? Today, I got Dr. DiMaria. Pleasure to have you here, Dr. DiMaria. Dr. DiMaria is actually our special guest. He's the medical director of the Bureau of Infectious Diseases at the Massachusetts Department of Public Health. So, Dr. DiMaria, it's so nice to have you. And my first question to you is, when do we get the flu shot? And why do we get it every year?
Well, influenza, people don't really appreciate how bad influenza can be and how much the complications and the mortality related to influenza really impact society. And I think that once that's realized, people will realize they need to protect themselves from it. The best way to protect yourself from influenza is getting a flu shot. You really need to get a flu shot every year because the influenza viruses change over time. So they mutate and they change and they escape your antibodies that the vaccine provides you with. And so the vaccine needs to be boosted every year, and sometimes the vaccine actually has to be changed. Like this year, 2 of the viruses the vaccine protects against have been changed because of the virus evolving.
Well, since you said that, a lot of people have asked me a question in regard to how do we determine what type of flu we're going to get this year. So I guess the questions I have for you is, how do we monitor it, and how do you go about determining what type of flu type that we're going to have in this season?
There's a big international system of collecting influenza viruses and analyzing those influenza viruses, studying what's circulating. So each year around February, the World Health Organization, the CDC, the Centers for Disease Control and Prevention, they get together and decide upon what strains of the virus will go into the vaccine. Right now, there are 3 strains of the vaccine. One of them is the 2009 pandemic strain, which has actually remained very similar to its origins. And there's another influenza A virus. There are various kinds of influenza viruses, influenza A virus and influenza B virus, which are new because they changed over time. And this was picked up by that international surveillance system, and a decision was made to change. Next year, they'll actually be vaccinating with 4 different strains to cover some of the lapses. Because every few years, they don't pick the best strain. So the vaccine is not as protective as it could be if there was a good match. So sometimes the match isn't good, but most years, the vast majority of years, the match is very good. The vaccine is protective.
So, Kathy, I don't know about you. Do you have any additional comments to what Dr. DiMaria just said?
Well, actually, so basically what we want the public to know is that they need to get a shot every year, regardless of the strain, and every year the vaccine itself is effective.
Right, so people, how effective is it? Well, a lot depends on who's getting the vaccine. Obviously, someone whose immune system is somehow compromised is not going to have as good a response. But the fact is, if it's not used, it's 100% ineffective. So getting the vaccine can help everyone, regardless of how effective it is in that individual. And especially children, because children are at risk of the complications of influenza, but also bring influenza into the community, bring influenza home from school, and spread influenza in the community. So for their own sake and for the sake of their contacts, especially maybe their grandparents who may not have as robust a response to the vaccine as the children, you can protect them by vaccinating their grandchildren. So right now, the CDC recommends that everyone 6 months of age and older in the United States gets a flu shot every year. And the every year, again, because the virus changes, your body needs that little boost of immunity. And that flu shot, you start getting it in August through March, because there's still flu activity even that late. So you should never think it's too late to get a flu shot, but The earlier you do it, the better, because then you get it done. Because I think, people sort of forget about it, especially after the holidays.
I think you're right, and I don't think that the public really is aware that you can get it anytime during the year, the shot that is. So that's really good information.
Yes, and Dr. DiMaria, I have a question. Can you get the flu during the summer? Can you get the flu during the spring, all year round?
That's a good question. In other parts of the world, influenza does circulate during all seasons, especially in the tropics. So if you travel, if you go on a cruise, that's where we sometimes see an isolated influenza case, in May or in August, in unusual times of the year. It's often because of travel. So, I think we currently recommend that if you're going to travel, you should get a flu shot even late in the season. Usually the flu vaccine outdates on June 30th. So if you know you're going to travel in July or August and you didn't get a flu shot for some reason to cover you for our influenza season, it's still good to get a flu shot even in May and June if you're going to travel.
Oh, so that's interesting. I didn't know that. I didn't know that. That was interesting. So it's basically if you're traveling somewhere else out of the country, or is it basically?
The southern hemisphere, because their winter is our summer.
That's right.
So
that's right.
They're having flu season when we're having summer. We're having flu season when they're having summer.
And is that how we determine what kind of strain we're getting here?
Yes, because that's why you need that international surveillance system, because what's circulating in Australia now is very likely to be circulating in the United States in January and February, when we usually see influenza activity.
So what are we being inoculated for this season? What type of strains?
There are 3 strains in the vaccine, and that's been typical for a number of years. One of them is the 2009 pandemic strain, which is still circulating in the world. And for many years now, for several years, it can't be many years, but for several years, it's been a predominant strain. Then there's another strain called H3N2 influenza A, and that's a strain that every few years is the primary cause of influenza. And then there's an influenza B virus. The B viruses tend to cause more infection in younger people because they change less over time. So the older you get, the more immunity you tend to have to those B viruses. But they're planning to add a second B virus next year because the B viruses tend to flip back and forth between 2 strains. And sometimes they don't pick the right strain. That's more likely to happen than not picking the right strain for the influenza A virus. So, and the vaccine is made up of not whole viruses, but rather parts of the virus that cause you to make antibodies that protect you against infection.
Well, that's interesting, because my next question is, can you get the flu by getting the flu vaccine?
Absolutely not. You can't get the flu from the flu vaccine because there's no flu virus in it. And some people, you may get a little achiness, you may get a low-grade fever after getting a flu shot. That's actually much, more unusual than I think people realize. They actually did a great study a few years ago where they took 400 people and they gave them a flu shot. They took 400, these are healthy young workers, 400 people, and they gave them a half cc, the same amount of just normal saline, which is just salt water. And then they called up the people a week later and said, did you have any, achiness, fever, flu-like symptoms after you got your flu shot? And 35% of the people who got the flu shot said yes, and 35% of people who got the placebo, the inactive, water, said they got a flu shot as well. So I think that points out there's a lot of other reasons why people might have symptoms. There may be, people may sort of notice achiness they wouldn't notice otherwise. And sometimes they just get a different kind of viral infection. It's not influenza and associated with the vaccine. So you can't get flu from the vaccine. It has a very, very good safety record. And definitely, every year, literally thousands of people die because they get influenza. But every year, people don't die from a flu shot.
So that being said, because so many people think that they do get sick or will get sick after they receive the vaccine, but could the vaccine somewhat depress the immune system where they might pick up another virus?
Actually, the vaccine actually should heighten your immune response because it triggers a lot of non-specific immune responses as part of the antibody formation. So it doesn't in any way reduce your immunity. If anything, it provides you with a little boost. So, although it doesn't really, I wouldn't say that it would prevent you from getting another virus, because obviously it doesn't. But
Well, what about when we're at flu clinics and the first question that the nurse asks the patient is, are you allergic to eggs? Can you speak to that issue or would that?
yeah, egg allergy is a concern because up till the present, flu vaccine is made actually of hen's eggs, so it has a little bit of egg protein in it. I think we were overly cautious for many years, which is not understandable. It turns out the egg allergy probably isn't as big an issue as we thought. There were actually new guidelines that talk about what kinds of egg allergy. For example, if you can eat lightly cooked eggs without having a reaction, then you don't really have an egg allergy. And these recommendations should be examined by practitioners and by people having flu clinics to answer those questions. It's a little too complicated to go into, but they were recently published in the CDC's Morbidity and Mortality Weekly Report from the Advisory Committee on Immunization Practices. So we still worry about that. You still have to ask the question. It's still a concern, but then you want to take a history about what kind of allergy a person really has.
That was a really good question. Dr. DiMaria, just to back up just a little bit on talking about the swine flu and the bird flu, because people still talk about that a little bit. And it's in the news about how people in other countries are dying. So could you just give us a little bit of an update on that? And what are our chances of getting the bird flu or swine flu?
Well, these are things that we're looking at very closely. The bird flu emerged as a human infection in 1997 and came back in 2003. And several hundred people have acquired it so far. Almost all from direct exposure to birds. There's very little evidence, very minor evidence of person-to-person transmission, which is what we really worry about. So birds have every single kind of flu virus that's out there. In fact, flu viruses, the influenza A viruses, probably are ultimately bird viruses that happen to adapt to people and actually other animals. Dogs get the flu, horses get the flu, pigs get the flu, they get the different strains of the flu. So what's worrisome about H5N1 is not that it presents an immediate threat, because the likelihood of getting, when you consider 300 billion people, or I'm sorry, 3 billion people have been exposed to it, and there have only been about 400 cases, the risk is extraordinarily low. But if it ever acquired the capacity to move from person to person, then it would be a concern. And another thing we're looking at, too, in the United States, is a little less threatening because it hasn't really caused much illness in the people who have acquired it. It's a so-called H3N2 variant, which is a flu virus that comes from pigs and has some of the 2009 pandemic virus in it. Unfortunately, flu viruses can mix and match their genes, so it acquired some, at one time a person or a pig was infected with two viruses that then came together. But this is a concern because there have been transmissions to people. In fact, many of them related to state fairs, state and local county fairs with animal exhibits. So we're warning people to just be careful when they go to those fairs, because what we're concerned about is person-to-person transmission. So far, mostly children, mostly minor illness, very few hospitalizations. But it's something we need to be alert to, because the next pandemic could come from anywhere. Just because we had a pandemic in 2009, unfortunately, it wasn't severe, doesn't mean we can't have a pandemic at any time again. So it's something to watch.
Well, can I ask, the H1N1 vaccine is now included in the regular influenza vaccination?
That's the bird flu.
The bird flu. Is the H3N2V, otherwise known as a swine flu?
No, so actually the H5N1 isn't there because it really, the risk is so low that it would not be worthwhile putting it in the vaccine until and unless it emerges as a human infecting agent. So right now, the 2009 H1N1 is in there, and the H3N2 that is not the variant, the swine variant, and then that influenza B virus.
And can I just, we have a couple fairs coming up, and you mentioned, having the people that are visiting those fairs to be careful, and be careful how not to touch the animals, or what advice would you give parents, I think, would be, children who are reaching and touching the animals?
Yeah, I think you have to be careful and be alert to exposure. It goes beyond flu because there are other things that might cause problems in those kinds of exposures. The key thing is make sure there's good hand washing. If the children do touch the animal, make sure there's good hand washing. Many fairs now have sanitizers available inside or out. They have postings about what to do to avoid exposure. We would also say that if you're immune compromised or you have some underlying condition that might put you at higher risk of unusual infections, including influenza from animals, then maybe you would bypass going into those exhibits. But we don't want to keep people away from these animal exhibits because it's a way of learning about agriculture. And so there are reasonable precautions. Just like, influenza can be prevented very effectively by vaccination, but it's also important to consider hand washing, covering coughs. I still see people coughing into their hands, which drives me crazy.
I have a habit of that.
Coughing into your sleeve. It took me a while to get over that hand thing.
Yeah.
Because then you touch things, and if you touch surfaces, you touch your nose and mouth. So, people say, well, maybe we shouldn't shake hands. Well, you can shake hands as long as you don't touch your eyes or your nose with a potentially contaminated hand until you sanitize it or wash it. So I think people have to pay attention to those things too, because there are other things that can cause respiratory illness. Even I'm recovering from a respiratory illness right now, as careful as I am. So I think people should take those precautions as well as get vaccinated. But the vaccine is the best way to prevent influenza.
So for our viewers at home, maybe you want to take some Purell or any other type of hand sanitizer with you if you're going to the zoo or if you're going to any of these health fairs. I think that'd be a great idea. Dr. DeMaria, I have another question in regard to birds. A lot of people have bird houses in their backyard and they have birds that they feed all the time. Can you talk on that if there's any contamination there? Because they're always putting the food in the bird house and they're touching where the bird is actually standing or sitting, and they're defecating right there too. So is there a risk there for some individuals?
Well, there's a risk, again, people who are immunocompromised or have medical conditions that might put them at risk. There are some risks involved. Again, hand washing and reasonable precautions are important. I think there's very little risk from the flu because most of those bird strains, and that's why H5N1 in Asia is so unusual, and that it's spread to Europe and Africa as well, because it can jump to people on occasion. So most of those bird viruses actually don't jump on occasion. Likewise, the dog virus and horse virus tend to be very specific. So it's actually, it's interesting that the pig is the most permissive for viruses. The pig can get human viruses and bird viruses, and that's why you hear about pigs being involved in influenza dynamics and pandemic emergence because of that capacity that they have. But for people, I think, reasonable precaution. I mean, those precautions should be taken regardless of influenza.
Well, you spoke about hand washing and hand sanitizers. I feel that more people depend on hand sanitizers, but is it true that hand washing is the most effective way to reduce, contact with viruses?
Yeah, for certain viruses, they're relative. Influenza virus is very sensitive to alcohol, so the alcohol rubs work really well. The lotions and rubs and so forth, the gels. But some viruses not as well. So hand washing, norovirus, which causes vomiting and diarrhea, tends to be somewhat resistant to the alcohol and the alcohol gels and rubs. So I think when you have the opportunity to wash, you never miss an opportunity to wash your hands. And anytime you don't have that opportunity, the sanitizers work well too.
Well, I'm glad you elaborated on that. That's important because, you don't think of that. You think that these hand sanitizers are just going to do the job. And because you see in the hospitals too that, the nurses and the doctors, they have their little wash in, wash out their foam, and that's sufficient. You don't see them washing their hands too much anymore. So I always thought that was a concern. And from what you just said to us, should we be concerned in the hospitals where they're just using the foam and not really washing?
No, because studies have shown that the alcohol products for hand sanitization work extremely well at reducing infection rates. So there's no question. We don't know how, they work well because they kill germs. And they may be working well because people weren't washing their hands when it's much easier to use a sanitizer. So we really want to encourage the use of the sanitizer. But you'll see in hospitals now, if people have the complication of antibiotics, Clostridium difficile, which causes diarrhea, a lot of people have heard about it. That is a spore that is relatively resistant to alcohol. So you'll see that for those patients, people do wash their hands because of the advantage. And often, actually, they'll then sanitize their hands after they wash their hands, which is only can help more, I suppose. But
To other pathogens.
Yeah. But for most purposes, those hand sanitizers I carry one with me everywhere I go.
Oh, that's good. That's good. I know, this has been so exciting. Dr. DiMaria, do you have any closing thoughts? I actually have a question for you. I know we have a problem with West Nile virus right now and Triple E. Can you just update us on that a little bit? What's happening in Massachusetts?
Yeah, this year has been a bad year from the standpoint of what we're finding in terms of Triple E and West Nile virus. In many diverse places, we're finding positive mosquitoes. As we are here today, we've had 3 West Nile virus cases. We may have more. I think we've been fortunate we haven't seen a Triple E case, and we haven't seen more West Nile virus cases, because in some parts of the country, we've literally seen hundreds and hundreds of cases this year. And we're seeing a lot of positive mosquitoes. So I think it's very important that people, depending on when they hear this, even into October, mosquitoes can be active, and they're more likely to be infected later in the season because they have more opportunity to get infected. And some of these mosquitoes are quite long-lived. So you really need to pay attention to those precautions. With cooler weather, the mosquitoes are less active, so that helps. But if you're going to sit outdoors or you're going to be outdoors between dusk and dawn, you really want to make sure you're either fully clothed or you have repellent on so that you can reduce your risk. You can't prevent every mosquito bite, but the more you prevent, the better off you are.
So, can you just tell us the time period when a person is bitten by a mosquito to some of the first symptoms? And what are those symptoms?
We have to keep in mind that a very small proportion of mosquitoes are infected. So mosquito bite doesn't mean you're going to get infected. It has to be an infected mosquito. It's a small proportion of the population of mosquitoes, but you don't want it. So if it's 1 in 10,000 and you get 1,000 mosquito bites, you have a 10% chance. If you reduce it down to 100 mosquito bites over the summer, you've reduced that by 90%. So what happens is when you are bit by an infected mosquito, 2 things can happen. Either you don't get infection at all, or you get the infection. If you get the infection with West Nile virus, the most likely thing is you're not going to have any symptoms at all. And only a small proportion of people get severe symptoms with West Nile virus. If you get bit by a mosquito infected with Triple E, which is a little more limited geographically in the state, but yet, if you get infected with that virus, you tend to get more severe disease. A larger proportion of people, almost everyone, I think, gets severe disease. So, for both reasons, sometimes people take West Nile virus, and because most people don't think it's a big deal. But if you're the one with the severe symptoms, you have inflammation of the brain, you have meningitis with it. That
Triple
needs to
E,
be
correct?
avoided. Triple E and West Nile.
And West Nile.
So it can happen with West Nile. So that's a good reason for people across Massachusetts to take reasonable precautions. You don't have to ruin your enjoyment of the outdoors, but take reasonable precautions.
Well, I was going to ask, just back up a little bit about the mosquito repellent. Is there a D, what is it called? D? Yeah, D. Do you have to have DEET in repellent in order for it to be effective?
DEET is a very effective repellent for mosquitoes. There are 3 other products that are licensed and approved by the Environmental Protection Agency. I think people, whatever you use, whether it's DEET or one of these other products, you should read the label because they only work as well as you use them appropriately. I think sometimes people think if they put on a DEET product in the morning, they're set for the day. It actually wears out over the day depending on the concentration. We don't recommend using concentration more than 30%, but you really need to pay attention to that label because you might have to apply it again in 6 hours, let's say.
So it's good to know. Yes. Dr. DiMaria, we're almost out of time, and it was such a pleasure to have you here today. Do you have any closing thoughts for us?
I think people, reasonable prevention can prevent a lot of disease and complications of disease. watching out for mosquitoes, we've talked about, and getting a flu shot every year is very important. I think I get a flu shot every single year, and I think there's evidence now that when you do that, it gives you a cumulative effect, so it makes you even more resistant to anything that comes down the line in terms of flu viruses. So I would strongly encourage people. The risk of flu vaccine is virtually zero. It's safer than most of the over-the-counter medications that we use without thinking about it. So I think that people should not think that it's a big deal getting a flu shot. They should get it. You can get it now at pharmacies. There's a website, mylocalclinic.com, where you can go to and find out where there's a nearby clinic, whether it's a town or a city-run clinic or a clinic in a pharmacy. So there's no reason, there's no convenience, people say, well, I just never got around to it. There's no reason you can't get around to it now because you can get a flu shot almost anywhere.
Oh, that's great. Can I ask one more question, Dr. DiMaria? Flu mist and flu vaccine. Are they both? Oh, that's interesting.
Yeah, now we actually have 9 different vaccine formulations and products available, and one of them is the live flu mist vaccine. It's a live attenuated flu virus that causes a very mild infection on the nose, but provides very good protection, better protection the younger you are. So it's approved in older people. We really sort of focus on children. Children tend to prefer it than getting a needle in their arm. So the flu mist is a very, very effective vaccine. There's really no reason not to get a flu mist if you're in the right age group, unless you're severely immunocompromised or you have exposure to somebody. And these are theoretical risks. The risk of influenza infection, actual influenza virus, is so much worse than the risk of flu mist. It's almost not comparable. So, I think if people are worried about flu mist because it's a live vaccine, I wouldn't worry about it.
Well, thank you.
Dr. DiMaria, what was the name of that website again?
mylocalclinic.com.
mylocalclinic.com. So maybe you want to check that out and maybe get some other information on there. And Dr. DiMaria, thank you so much. And Kathy, this was fun.
It was fun.
Looking forward to our second show.
All the best.
You swayed me to getting a flu shot.
Excellent.
Okay, me too. So Kathy, maybe we can go down to one of the local pharmacies and get our flu shots, and maybe the public will follow us too.
Maybe so. Or we also have our public health nurse who will be,
Yes, Cheryl.
Cheryl, will be providing clinics as well.
Oh, that's wonderful. Do you know when she'll be doing that?
Usually she starts in the late fall.
Okay, so you can check out our website too.
Our website will have that information on.
Right, and at the bottom of our screen, I'm sure our producer will be putting all those websites for you. So thank you very much for joining us today, bringing us into your living room and you coming into our living room. If you have any questions of public health concerns or questions that you'd like us to talk about, please email me at nancyzecco@Webster, little hyphen, GOV, was it GOV?
-ma.gov.
Thank you, it's new. So thank you very much and have a great day.
You can also visit our website at www.webster-ma.gov to see the airing of this show, and we will soon be on cable access.
So thank you very much. Thank you, Dr. DiMaria. It's a pleasure. Thanks, Kathy.
Thanks, Nancy.
Bye now.